Okie dokie. So, if your pet has seizures, balance problems, IVDD, difficulty walking, back or neck pain, that's what we're here for. This is Dr. Michael Wong and Dr. Daniel Webb, and we are here to answer your questions about veterinary neurology and a couple things. One, just in general, we're only able to answer so much without being able to evaluate your pet in person. So we'll apologize in advance. There's only so much that we can that we can answer there. If you're local, it's always best just call us, and we're happy to see your pet in person. We're just going to be able to give so much more information. If you're not local and you have a veterinary neurologist, or you're a veterinarian in your area, they're always just going to be able to give a lot more information specific to your pet because they're going to be able to examine them. If you've got questions, please submit them in the comments. If you're watching this on the replay, you can email them to Q&A, like question and answer, at SEVneurology.com, and we'll get you on a future show, whatever this is, future time. But if you have a question, it's best not to, if it's for one of these, please don't call one of the offices. All they're going to do is direct you to this, to email. But again, if you do want your pet evaluated, 24 hours, 7 days a week, we are available to help with your neurological conditions. Last thing, the 7 Synapse Conference is October 4th, Sunday. It's for veterinarians and veterinary technicians, 5 hours of CE credit. If you're interested in that, please send an email to Q&A@SEVneurology.com, and we'll get you set up with all the information that you need there. And we're going to be giving away a free registration for that. So send an email to Q&A@SEVneurology.com. So I think we have our first returning person. How are things going, Dr. Webb?
Things are good. Staying busy today. Got several MRIs going through.
All right. Well, hopefully we can help them.
Yep.
Hi there, Javita. Can you hear me all right?
Yeah.
All right. So what's going on with your puppy?
Oh,
how can Dr. Webb and I help you?
I'm in Minnesota. I'm just following the what should I say that I received. So I'm in Minnesota. 49 degrees here today. So you guys are lucky. And Misty is our dog. She's 6 years old and she's Coton-de-Tulear. So a breed prone to IVDD, which she was diagnosed with in spring. And her case was mild, so it was only rest and medication, and MRI was not suggested, and she recovered nicely. And she seems to be having a flare-up right now. And she was slow on Friday and started shaking really strongly. And so we put cane crate, we got her medication. And her problem is that our vet is not very knowledgeable about this disease, and we cannot see a neurologist anytime soon. So vet didn't recommend crate rest at all. And I'm crating her still, but so my question would be, for how long should I be doing that? She was checked and her spine didn't seem sore, and except for this shaking, there were no other symptoms. And since she took the meds, she seems fine. She can lie on her back, wags her tail, looks completely normal, doesn't seem down. And so today is the 6th day that she's in crate, and I've been trying to look it up on the internet, and everywhere I read is 8 weeks, which I don't know, is it needed for her? What do you think?
Dr. Webb, I don't know if you've got any other questions for her.
No, I understand your pain. I did my residency training at Wisconsin, so I understand the cold, but I have more weather here now for sure. But yeah, so the questions as far as, crate resting. So again, as a generality, for patients that truly have had, disc herniations that have been confirmed, most of the time, we would recommend crate resting anywhere from 3 to 4 weeks. And most of the time I do push for 4. The reason why we push for crate resting with dogs that have had a disc herniation is there's actually a kind of a rupture of the outer part of the disc, and it can take up to about 2 to 3 weeks for that to heal up and scar down. So sometimes patients are at a risk of repeating a herniation during that time frame. So generally about 3 to 4 weeks for dogs that have disc herniations of rest is what we recommend. And then for dogs that have had repeated events of disc herniations, sometimes we try to avoid that high impact activity like jumping, running, roughhousing, stairs. I try to get them to avoid it for at least 2 to 3 months as best as possible. Sometimes trying to avoid like big impacts like jumping off of furniture, jumping in and out of cars. If we can avoid that lifelong, that's helpful for these patients. But for any patient that's showing, signs of discomfort or pain, having them evaluated, even just baseline, is this neurologic, yes or no? Because other things can cause some trembling and can cause some discomfort. So always, following up with your vet of, hey, this changed or this hasn't completely resolved is always super helpful, because sometimes things look neurologic that aren't. But in general, about 3 to 4 weeks for disc herniations of rest.
I see. And what are your thoughts, does it mean a bad thing for us that it returned so soon? Because I feel we've been taking every precaution. We've been taking her for walks on leash, potty on leash, and moderate activity, no jumping and no stairs. So it still happened just a few months later.
Yeah, for sure. So, certainly you can take all the right precautions and we can still have, disc herniations for some of these patients if that's truly what's going on. You can follow everything, and sometimes it just happens. When you have a disc herniation, there's a genetic, predisposition for these guys to calcify that disc, and it's not fluid filled anymore. So, there's no amount of restriction of activity that's going to take away their body kind of going through that process. So you can do everything perfectly right, and unfortunately we can still have disc herniations, and dogs that have had herniations in the past can certainly have them repeated in the future.
Dr. Webb, do you have any sort of recommendations on, so say someone brings a pet to you and we're suspecting it's a slip disc and symptoms are mild, it's back pain only or mild wobbly walking, I guess, do you have a rule of thumb or information that you can give people on, I guess, when to say it's not working anymore and when we should consider when you should go back to your vet, when you should say, hey, crate rest and medications isn't working? I guess, do you have rules of thumb there?
For sure. Yeah. So, and then, if they have one event and they're responding well to pain medications, they respond well to the rest, I generally will recheck them and do another evaluation and then start a slow reintroduction to activity. But for any patient whose pain isn't adequately controlled or they're having these repeated bouts of pain periodically, those are the patients that I generally say, hey, maybe we do need to image. There's periods or certain patients where they have a herniation, they never really lose the ability to walk, but that herniation is quite large, could be involving a nerve root, or it could be causing more compression than what they can really just handle. So sometimes even, if it's been a long time, they'll need a surgical intervention to kind of debulk that disc, and we can get those guys a little bit more comfortable long-term. So any dog that is refractory to pain medication or any dog that worsens neurologically would be a candidate, I think, for a more advanced workup, considering MRI. Does that answer that question?
Yes. And we've been prescribed medication for a week. Does that sound right to you?
So it all just depends on the patient, like how they respond. It sounds like, Misty got a little bit better on that. Generally, what I would do is I try to do multimodal pain management. So sometimes an anti-inflammatory, sometimes some nerve pain medication, sometimes muscle relaxants. And it all just depends on what that patient looks like and how they respond to that exam. And then sometimes I'll slowly wean them off. One medication will stop first, then the second medication will stop. And all that time they're on rest. And so it's nice to try not to go from 0 to 100 as far as activity, and also from a pain management. You don't want to go from having all the pain meds to no pain meds generally. But again, very patient dependent.
Yeah, I believe that is all. Oh, well, I feel it's worse than I thought it would be. I was just hoping that maybe it would be shorter rest for her because I don't know. Do you think I should try to get the neurologist, or it's worthwhile waiting still? I don't know if it's a ticking bomb. I don't want to sit around and next time maybe she's paralyzed or.
Yeah, I mean, if at any point you're concerned with your pet, starting with a baseline visit with your veterinarian of let's make sure there's not other things at play. And if they feel that there's truly a neurologic component to what we're seeing, back pain or difficulty walking, and then they can always help get you a referral to a neurologist if that's what we want to go for. But always a baseline check with your vet, and then absolutely you could get referred out.
Okay. Okay. Thank you.
I guess my approach with that is if it's worrying you, if it's worrying you enough to be doing all of this research on the internet to be here with us, it doesn't hurt to meet with a neurologist in your area. And, hopefully they say, yep, you're on the right track, keep doing what you're doing. Or if they do think that it's more of a problem, they can recommend that. So I don't think you have a whole lot to lose by meeting with a neurologist to find out what's going on. It doesn't necessarily obligate you to doing surgery or MRIs or anything like that, but just similar to what we're doing now, they're going to be able to do so much more. They're going to be able to do even more by examining your pet in person.
Yeah. I'll probably do that. That's what we did in spring. I didn't feel that our vet knew enough about it, so eventually we were able to see a neurologist, and to us the situation felt bleak, but she didn't feel so I was feeling very positive and thinking, maybe it will not happen for a very long time, and we took every precaution, and now it's been like 4.5 months maybe, and this is back, so it's very unexpected to me, and but yeah, I suppose we should see them again and see where we stand.
Okay, I think that would be a good first step.
Okay, thank you guys.
All right.
Absolutely.
Best of luck. Take care.
Thank you. Bye-bye.
Sarah says, how safe is it to have a dachshund with epilepsy fixed? My vet is very hesitant to do the procedure, but when she comes into heat, her seizures are worse. So there are probably a couple different things to talk about there. Just the anesthetic safety of a dog with seizures, and then the relationship of seizures to estrus.
So there are some reports out there that there's definitely an increase in seizure activity for some pets that are still intact and still going through estrus. So, and also if a pet has been, diagnosed with epilepsy, there's a genetic component suspected for that as well. So generally I do recommend that those patients are spayed, and then there always comes the question, is general anesthesia safe for patients with seizures? So in general, if it's truly an epileptic, you haven't had anything identified on an MRI brain tumor or other congenital malformation. Generally, general anesthesia is safe as long as, you know, the pre-op blood work and other safety checks have been met. And generally, anesthesia is what we kind of use as a last line defense to stop seizures for patients that are really bad. So the anesthetic itself is generally pretty safe. Sometimes we can have seizures when patients are waking up, and you know, we can address that as needed, but a lot of it will depend on how well is, you know, everything controlled prior to anesthesia, as well as your pet on medications, you know, those sorts of things. So I don't let anesthesia be an absolute no for seizure patients, but you just need to get evaluated and figure out where they are. But most of the time it's very safe for them.
I feel like I get a lot of questions of, you know, drugs to avoid and what drugs to use and what drugs not to use. And obviously, you know, even when someone calls, I can't give that answer for one particular dog without seeing them and reviewing records. But I guess, are there generalities of medications that you know, are more cautious or less cautious about, or more comfortable with, I guess I should say?
Yeah, I mean, generally we'll use like midazolam or benzodiazepine for induction, along with a type of pain medication, so like either butorphanol or something along those lines. Midazolam is actually helpful for stopping seizures, as well as, you know, one of our rescue medications that we can give them in hospital. So, I mean, I generally go with those things. There's not a ton of medication.
Same for an MRI.
Yeah, for MRI or for an induction of anything, for any patient with seizure.
So on on phenobarbital, zonisamide, Keppra, and 5-month seizure free. So, so Sarah, I guess the take home would be, there's not a contraindication to be anesthetized from a seizure standpoint. The things that we worry about are, what's the underlying cause of the seizures, and could that affect how safe anesthesia is? Meaning dogs that have brain tumors or encephalitis, if they're having seizures due to an underlying cause, a liver shunt, something like that, yeah, those are things that we're more cautious about with anesthesia. But if she's an epileptic, you know, let's say she's a 4-year-old dachshund that's had seizures for 2 years, has a normal MRI and is otherwise healthy, you know, heart sounds fine, lungs sound fine, blood work is normal, we don't really see any contraindication to being spayed just because we have seizures, or contraindication for anesthesia just because we have seizures. And then with regards to medications, that's something that your veterinarian is going to be able to answer best based off of, you know, age, breed, examination. You know, in general, we try and avoid drugs like, I don't like using a lot of ketamine. I don't like using a lot of Domator for dogs with seizures, but that's me. Looks like Noelle's a little bit early. Hi there. Can you hear us all right? Can you hear me?
Yes, I can hear you.
Hi, how are you? I'm Dr. Wong. This is Dr. Blake Webb. Tell us about Freddie.
Okay, so Freddie is an almost 8 Spinoni Italiano. He weighs about 90 pounds. He had his first epileptic, to our knowledge, first epileptic seizure when he was about 2.5 in 2015. It was early morning. I thought he was having a dream. He was doing that thing with his legs, and then it didn't stop. And then it was the worst one he ever had, because he was like, he didn't know who we were. He was foaming at the mouth. He started barking at us. He bit my husband, because we didn't know what to do, because I had never seen this before. So we took him to our vet, who happens to be, I'm in Brooklyn, by the way, so we just walked him over to our vet a block away, and they did whatever tests, and they put him on Keppra immediately. And we went 15 months without a seizure after that. And then we're like, cool, it was a fluke. He doesn't have epilepsy. It was just like he ate something. And then they started coming more regularly. And then we got into the whole pharmaceutical experiment that you do with your dog with epilepsy. And now he's on zonisamide, phenobarbital, potassium bromide, and Keppra. Like they removed the Keppra and they put him on zonisamide, and then it didn't, like they kept coming, so they added the pheno. And there's all these scary things about like, oh, the pheno and the liver. And so we've been terrified of phenobarbital the whole time, but it seems to be the drug that is the most effective when used, because this last week, he had his first like seemingly never-ending cluster. He had about 9 seizures in 36 hours. And normally what we would do is he would have a seizure, we give him 1 Keppra and that would stave off any further ones. So we're in this like, what is happening? Things were sort of, our goal is to like, obviously it's never gonna go away. We wanna manage it and obviously like shorten the fits as much as we can or make them as less as possible. And obviously clusters are no fun. I'm obsessive about like all the data points that I can possibly, I created these like massive spreadsheets of like everything from the position of the moon that day to like the temperature, what he ate and everything. And I've driven myself crazy and I just want to know if I'm doing everything and if you know of any sort of things I should focus on, like the one new condition that I'm guessing, but I'm not a professional, is contributing to this new cluster nature is in April, we did his normal blood work and his thyroid level was very, very low, like off the charts low. And we're still trying to get it up to a comfortable level. We've been sort of giving him thyro and then increasing it because they retest and it's still low. So we're still not in a good range yet. That's the only thing I can think of that is new that would, because things were like every 30 to 50 days and we're like, okay, that is manageable. Like we can actually like have a life. And now it's like back to square one with the unpredictability.
Yeah, for sure. And it's super frustrating to watch your pet go through it, you know, as well, for sure. So, yeah, so things, you know, to be keyed in on for, you know, we have lots of patients that can be, you know, diagnosed as, you know, presumptively epileptic when they're young, you know, they're neurologically normal. And sometimes they can get to where they can be what's called refractory. So they can be on multiple medications, which it sounds like is the case for your pet. And then they're not responding to those meds anymore. And so that's always a concern for an epileptic patient.
How do you define not responding? Like, is it every day having seizures? Is it having them at all? Like, what does that mean?
Yeah, so we have kind of like set guidelines. There's a consensus statement with ACVIM. And so essentially the goal should be for seizure freedom. And sometimes that's a lofty goal, and we don't always achieve that with all of our patients. But generally 1 seizure or less every 3 months is kind of my goal for most epileptics that you try to reach for as best as we can. And again, sometimes we don't get that with every patient that has epilepsy. So, you know, getting into a refractory epilepsy that's not being well controlled is certainly possible. Another thing to be concerned about as patients age, they can develop a new underlying neurological problem. So sometimes with older patients, you worry, have they developed a brain tumor or something else, some underlying liver dysfunction, encephalitis, you know, those are things that you can worry about as well if you see an increase in seizure frequency in an otherwise previously well-controlled patient. So those would be the things that I worry about when I hear those kinds of histories. Obviously having that patient evaluated by a neurologist, checking the neuro exam. Is the neuro exam normal? Is there signs of dysfunction? And, you know, discussing pluses and minuses of an MRI would be something to consider. And then also we want to make sure we start juggling a lot of drugs with patients that, you know, are on 4 or 5 different things, knowing of have we maximized the drugs that we're on to the best of their ability is important. So checking drug levels, making sure that we're kind of pushing them into the highest therapeutic ranges that are safe for that patient is another very important thing if they're in that refractory kind of position. But have to, evaluate and go through all those records, and your vet or a neurologist could go through that with you and talk about the steps that could be done.
As I'm sure you know, there are tons of groups on Facebook and stuff of like people who are dealing with epileptic dogs, and everybody has their own theories or their own whatever their vet has told them. And a lot of people focus on diet, and some people are like raw all the way, only raw, always raw. Other people, there's some dog food called Neuro, I guess, that one of the big manufacturers makes. But then the demon food is rosemary for some reason. But do all dogs have the same triggers, or is it possible that rosemary is a benign element for my dog?
Yeah. So those are good questions. There's not a significant amount of research in animals. There are some types of epilepsy in people that can be responsive to diet trials. And I think a lot of what we see in animals now, they're trying to bring over from these rarer types of epilepsy in people. And to be honest, I don't think we have all the information to really make those decisions. There is a commercialized brand of dog food that's out there that does have some research that showed that it could reduce some of the seizure activity for dogs. In my opinion, from what I remember, it was not an aggressively dramatic decrease, and some of the cluster dogs still had clusters. Those dogs were all still on medications. So, you have to take everything with a bit of grain of salt, but, there are some diets that have some research to at least help and not hurt when it comes to trying to manage epilepsy. But again, we're talking about dogs that have been diagnosed with epilepsy, and, we have to know exactly what that study is saying for what population of dogs.
Right. So it's just sort of a trial and error on everything. It's not, like even pharmaceutically.
Yeah, and I tell all owners, like, epilepsy is not like a singular diagnosis. Every dog could be different as to what receptors or transmitters are not working for them. They may respond well to one drug over another. So epilepsy is not like a uniform disease, unfortunately.
The only thing I can think of that like preceded his seemingly first episode was that he had this chronic ear infection. I don't know if you know Spinoni, but they have really long ears, and he swims, and it was just like, we could not shake it. They threw every possible antibiotic, ointment, everything in there. And then I was like, was it that we didn't deal with his ear soon enough? Like, can an ear infection create epilepsy?
Yeah, so that's a good question. So ear infections, if they become very advanced, so we're talking about not just in the external ear canal, but start to move into those internal structures, you start calling that like otitis media or interna, so deep ear infections. Those can get through the normal bony structures and get into the brain and cause encephalitis. I've had a few patients that have had seizures with that. But if you have an ear infection that bad, you have a lot of other neurological signs that are going on. So I think that that's probably unlikely. In a very severe case, it could happen, and I've seen it, but unlikely without seeing lots of other neurological signs.
Okay, thank you. I guess as far as all of the pharmaceuticals that he's also on 2 Chinese herbs. He takes CBD oil, which, like, I don't know if it has any effect on him at all. All I know is that once he started the CBD oil, he started wagging his tail again. And I was like, well, if it even gives him like comfort and happiness, that's good enough for me. It's not hurting him. But is it folly to even think about like reducing anything? Like, is it just like, it's always going to be increased and we'll never be able to take anything out? Or is it just like, there's a certain amount of time he could go without seizures before you would even consider it?
Yeah, so when you're considering drug changes for a patient with seizures, the considerations are clinical signs and side effects, like is the patient tolerating this drug, and then what is your seizure control? And so when you have a patient that sounds like they're not well controlled at this point, generally I don't try to remove drugs in that time frame. I try to, again, where are our levels? Can we maximize things to greatest benefit while also trying to avoid that side effects? And you know, sometimes they can be sedate, little drunken when you make those changes. So in general, I try not to remove things if patients are not currently well controlled. If I can get them into a better controlled state, you know, then you start weighing pros and cons of, can we remove something? But that generally, you know, you need your neurologist to be working with you and kind of closely following out what happens when you do those things.
This is a totally random question, but like I'm in New York City, and to find a neurology specialist is like near impossible. And every time you find one, by the time I can get an appointment, they've left. Like, are there only 10 of you in the world? It's like, I can't find one.
Yeah, COVID has made things a little difficult. Some hospitals are limiting, you know, patients coming in and out. We're trying to keep people safe, and we're being short-staffed, so it can be frustrating during this time. So I completely can empathize with that. There's more than 10 of us. I think there's, you know, somewhere around about 300 of us, I think, practicing in the US, probably a bit more than that now, but they are available. I would just be persistent. If you have some people that are close to you, you know, reach out to them, say, hey, this is, you know, the situation, you know, what is the earliest availability? And you can always, you know, give some prelim information, like, you know, my dog is having seizures, they're poorly controlled. And sometimes we can prioritize patients of how soon they need to be seen. So I would just, you know, reach out, ask for appointment times, you know, have your records and say, hey, I'm ready, you know, to send all this over if we can get in.
Yeah, I mean, there are a lot in the New York City area. I mean, I know a couple.
Berg left.
I'm sorry?
Like, even the one near me in Brooklyn, which is like a big hospital, which Freddie spent 3 days at earlier this month for a gastro episode. But
yeah,
it's like, I'll see them on the staff, and then when I go back to check, like, they're no longer on staff. I don't know where they're going.
Yeah, I mean, if you go to acvim.org, or vetspecialists.com, you can do a search, but I mean, there are some in Manhattan. I know Brooklyn, I'm not as familiar. I remember there was one there, and then I think she went to Texas, and then there was one, I don't know if it was the same hospital, and
you all know each other.
But then in Yonkers there are a couple, and then for some reason I thought you were in Connecticut. I don't know.
I was in Connecticut. We go to both places.
Yeah, and there are some great ones in Connecticut as well. So you're not too far from probably 10 or 15 great neurologists.
Oh, good. All right, then I just gotta look harder. So
go ahead.
If you had to stack rank like something I could focus on, because I feel like this is practically my full-time job, like trying to, I mean, and for what it's worth, like his quality of life is great. Like when he's not having a cluster, he's like running on the beach, swimming with me next to my kayak. Like he's got a sister who's like, they have the same father, but she doesn't have epilepsy. And like he has a great life. It's like a ticking time bomb. Like there's constant anxiety. Like every time he does anything weird, like looks over there because he sees a bird or something, I'm thinking, it's coming. Like, is there anything that you could recommend that I could personally focus on, not as a neurologist, like as the mom, to like improve? Like, is it diet? Is it getting to the bottom of this thyroid thing? How do I stack rank these things so I don't drive myself nuts?
Yeah, so I mean, I think, you know, what you can do, the big thing is having owner compliance, making sure we're giving the medications at home. So, you know, I feel like you're probably an owner that's on top of that, but making sure that we're following instructions that we're given, making sure we're giving the medications as prescribed. It sounds like, you know, for you, the next step would be, you know, to get in to see a neurologist and talk about options. Do we need to suss out the thyroid issues? Are there signs of other neurological dysfunction we need to be aware of that would precipitate discussion of an MRI? And then, you know, managing these drugs, we're on multiple, can we maximize them and go from there? So I think that, you know, you're doing what you can, enjoy those good quality times that we have, keep them in safe areas when, they are having their seizures. And then working with a neurologist in your area, I think, is going to be the next best step to guide you as to what needs to be done.
Is a cluster a sign of something like worse? Like, is it an indicator of anything? Because I know some dogs, they just have clusters. Or is this something I'm just going to have to learn to live with? Or is this something that we can return to the one and done?
Yeah, so dogs that have had clusters do tend to be dogs that will cluster again once they've kind of developed it. It's not necessarily a side of any specific disease. It could be epilepsy. There could be other things going on within the brain, but these guys can present a challenge. And so sometimes, again, when we're maximizing our drugs, we can have protocols set for owners of, if you have one seizure, as soon as they're alert and can swallow, do XYZ steps. And sometimes we could try to help prevent them from getting into the cluster activity. And again, when you see your neurologist, they'll be able to help you set up a plan for your pet and maximize trying to prevent that activity from happening. But as far as, diet and stuff, I don't have any strong research to suggest there's more that can be done in that realm just yet.
Okay.
I guess I want to go back one step where you had said, his quality of life is great, but you're always stressed, and, what can you be doing as well? I mean, I think, like Dr. Webb said, you're doing a ton, and we can tell that you're on top of things, but I think realizing, one, that it's really uncommon for a pet to not come out of a seizure. So, I mean, you've been seeing it for 5 years now, that we have seizures and we usually don't die of a seizure. So I usually get that question surrounded by, we can't go out to dinner anymore. Obviously there are reasons nowadays that we're not going out to dinner, but people, their whole life revolves around giving these medications. So I think, one, realizing that the likelihood of something terrible happening if you're, if you aren't standing on top of him 24 hours a day is really, really low. Two, really just focusing on, not trying to stop all seizures, but trying to avoid these clusters. And that's where all the recommendations of getting the drug levels, meeting with a neurologist to make sure there isn't something else that we're missing, to help better control things. I think this is kind of where you were going, and I had just written down a note here. I guess, Dr. Webb, can you talk a little bit about rules of thumb of when, in general, it's an emergency, and when a dog that has seizures should be going into to see their veterinarian, or going to the emergency clinic if it's after hours, or going to a neurologist. So obviously first-time seizures, yes, but dog that's had seizures before, what are the times that we should be going in to see a doctor?
Yeah, so my general 2 rules for emergencies are dogs that experience cluster seizures, so 2 to 3 seizures within a 24-hour period of time. I generally recommend most dogs to go into an ER or come see me if they're local. Some dogs, as you know, are cluster dogs, and so sometimes they don't always have to go straight to a hospital, and there's protocols that we can try to work with at home, but generally cluster seizures are considered emergent. And the other one that I have is what we call status epilepticus, or essentially a prolonged seizure that they're not coming out of. So I practice that any seizure lasting 3 minutes or more, I consider status, and they should go to a hospital, and no matter what, if they have clusters or seizures for years, like if you go into status, that's a bad situation. So you should definitely seek immediate care in those situations. So those are kind of the 2 emergent, go see someone situations. But most of the time, I recommend all of my clients to either contact me or come in for a recheck whenever there's a big difference in the seizure frequency. Your pet went from being fairly well controlled to now not being, those are times to go in, not necessarily at 4 in the morning, but hey, I need to schedule an appointment. I've had a frequency change. Let's talk about things. And we can, again, work with you and change medications as needed.
Okay, thank you. So, I mean, his seizures have rarely go longer than 45 seconds. And in the last 2 or 3 years, and I don't know what to attribute it to, like he used to be sort of unconscious, and now he kind of is looking at us while he's having it, like, what is happening? He looks scared and he cries, but it's like does the nature of the seizure matter?
Yeah, so that's a great question. So generally, when we're talking about clusters and status, these patients are having generalized seizures. So overall, on their side, unconscious, paddling, urination, defecation, foaming at the mouth. But sometimes the types of seizures that you see can be different. So sometimes we can have a focal or partial seizure, where sometimes you're seeing twitching on one side of the face, sometimes the drooling, and sometimes they can have some level of consciousness where they're still, alert and responsive to people coming in and out of the room. So it's possible to see that in the lifespan of an epileptic change. They develop something new, and all the more reason to, make sure we're maximizing our medications and doing the best that we can.
Okay. Well, thank you so much for all of this time. I really appreciate it. And you're doing great work. And I wish dogs could talk and tell us what was happening.
That makes 3 of us.
Well, have a great day.
You too.
Thank you so much.
Take care.
You're welcome.
Hi, Anna. Can you hear me? You might need to unmute in the lower left.
Can you hear me now?
Perfect. How are you? I'm
Good.
Michael Wong. This is Blake Webb. Tell us about Merlin.
Thank you, first of all, for having me here. I have stage fright, so I'm going to read a bit about this. The question that I sent you, he's a 7-month-old Brussels Griffon. And I sent you the video of one of the episodes, but they're so fast that it's like by the time I got the video camera up and running, most of what I'm seeing was already over. He had like 4 of these episodes in a matter of 2 weeks' time. Now, I wanted my vet to try and go the way of the acid reflux because his father used to have things that looked like seizures with the foaming in the mouth and rolling his eyes back in his head. And they turned out to be acid reflux, but only because he did it in front of the vet did I ever find that out, because by what everybody else was seeing, they were all going seizure, So then I talked to the breeder of my male, and she said that her dogs do that when they're puppies, and it always turns out to be acid reflux, and they give them some kind of medication. So my vet really didn't want to do anything but send me for an MRI and a neurological thing. I called the neurologist, and they kind of said it was kind of early in this to be doing the major MRI stuff. So I put him on Pepsid at night. He's also a poop eater, so I followed him, making sure he absolutely can't get poop. My backyard is like a beach, so with poop comes lots and lots of sand. And so I been making sure he's not getting that, plus giving him the Pepsid at night and probiotics and pumpkin, and he hasn't had an episode since the 28th. So I don't know if this could be acid reflux, or am I just wishful thinking here?
Yeah, so that's a great question, and it's difficult for even us sometimes when we're faced with abnormal episodes of what are we actually seeing. So it can be really difficult. Obviously, the only way to 100% diagnose a seizure is to have all the electrodes and have an EEG on a patient when they're going through the actual seizure, which obviously that's next to impossible with veterinary patients of trying to throw electrodes in during that process. So a lot of times what we'll do as neurologists is we do rely on some of the videos that are presented at home. So thank you for catching that on video. It's super helpful. So generally when we have a patient that's having an abnormal event, generally at least an examination with your vet or to a veterinary neurologist is going to be recommended to look for, is there any other signs of dysfunction that would make a seizure more likely? And also watching the video that you have of, hey, could this represent seizure activity. And that's where, you would start. Sometimes it's unclear, what we're dealing with. Sometimes we'll trial some anti-seizure meds and see if we can get some improvement. Or if we don't think it's seizures, trial other medications such as Pepcid, because some dogs can have GI upset, and see if we get improvement if these episodes stop. So sometimes it can be real hit or miss as to, what we're able to do based off of just the exam.
I mean, certainly in the video, it looks like a seizure. Just there's kind of these repetitive movements. There's salivation. Doesn't look like Merlin's completely aware of what's going on. So, sure, it's our wishful thinking as well that this is something as benign as acid reflux, and it's not a seizure disorder. But I think there are a couple different ways that we can approach it. All of those ways go through, having him evaluated by a veterinarian, but we can approach it of, well, what's the more serious, more concerning thing, such as a seizure, and do we look for causes of seizures? I guess causes of seizures for me in a 7-month-old dog, I think of seizures as sort of 3 main things outside of the brain that can secondarily affect the brain, things like liver shunts, which young dogs get, low blood sugar, toxins, things like that. Then the second main cause of seizures that we think about is something physically wrong inside of the brain, whether it's a brain infection or a malformation, like water on the brain or hydrocephalus or a cyst or something like that. Even young dogs can get tumors in the brain. A little on the young side for something like encephalitis, but it's certainly possible. And then the third broad category of causes of seizures is epilepsy, which usually comes on between or idiopathic epilepsy, which usually comes on between 1 and 5 years of age, but 7 months, certainly possible. So yes, that examination by your veterinarian or a veterinary neurologist is going to help us steer, is it more likely to be a seizure disorder, or is it more likely to be gastrointestinal? And assuming it's a seizure disorder, is it more likely a physical problem in the brain, more likely a problem outside of the brain that's affecting the brain, like low blood sugar or a liver shunt? And really the only way we can get to the diagnosis of idiopathic epilepsy is by ruling all of those things out. So I was saying there are kind of 2 directions we can go. One would be looking further into causes of seizures versus looking into, is this more likely to be acid reflux? Again, can only say so much without having evaluated in person, but I think it would be much less likely based on the video that you sent that this would be acid reflux. And quite frankly, it sounds like unless his father had something similar, most people you wouldn't have even brought up the idea of acid reflux.
Right. Because we thought that was seizures back then with the foaming at the mouth and the passing out. And it was like, and then when he did it in front of the vet was like, oh, this is acid reflux. He's just scaring the crap out of himself. And this puppy only does it when he's sleeping. Every time he's done it, he was sound asleep and he jumps out of his sleep.
And that to me is just one more thing that throws a stick on the seizure pile. So I think, it makes sense to have some blood work done if we haven't done that already. Consider something like a bile acids, and that will kind of cast a wide net with regards to some causes of seizures, and may also sort of look down the avenue of is it more gastrointestinal. So
I did the blood work already.
Perfect.
Because I took him to the emergency vet when it happened, and they did all of the blood work. I took him to the big hospital in Largo.
Okay. And just make sure that that we also did something like a bile acid. So I guess what I would say is, it's tough for us to say just based on the video and without being able to examine in person. The video to me is more suggestive of a seizure disorder. I think you can look down both of those avenues at the same time of whether it's more GI or more seizure related. Some of the tests that we do kind of will look at both at the same time, but yes, I think we're all optimistic or hopeful that this is something, more benign, but I guess what I don't want to do is put blinders on to something that might be more serious,
Right.
and not look into causes of seizures.
If it hasn't happened in like 2 weeks, how would you know if they put him on seizure medication that it's working?
Yeah, so that would be another way of trying to further define whether it's GI or seizure would be a therapeutic trial. So, so trying anti-seizure medications would be, to me, a further down option. But yeah, if we go from having them, every 2 weeks to them going down to every, 6 weeks or something like that, that wouldn't necessarily prove, but it would certainly put more evidence towards it being a seizure disorder. Vice versa, if you decided to treat for acid reflux and these episodes went away, that would give some evidence that maybe it's not a seizure disorder. But to me, this is where tests come in, because right now we're sort of dealing in the, where we're not certain of anything, and we're, just kind of flying by the seat of our pants based off of what we think is going on, as opposed to doing tests to sort of narrow down what it could be and what it couldn't be.
Okay, thank you.
Sure. And you say you're in Largo, Florida?
No, I'm not. I drove all the way out there. I'm visually impaired, so it's hard for me to drive long distances. But I'm in Port Richey, Florida, and but when he had the third episode, it was in a small period of time. He had one, 4 days later he had two, and then 2 days later he had another one. So on the third episode, at first I thought he was choking, because he would jump up and he seemed like he was, choking on something. So I gave him a Heimlich and everything, and by the time I gave him the Heimlich, it was over. And the third time he was flailing around more. So that's when I thought, wow, this could be something more than him just, choking. So that's when I took him out I had to go to the ER, and I didn't want to go to a local ER. I wanted a good ER. So I drove out to the Largo, Tampa Bay hospital that's out there. And she said it was night terrors, that she did a neurological exam. He was totally normal, no problem. It's night terrors. So I said, okay. I went home. She did all the blood work. And then I got that video clip, and I sent her the video clip, and she got back to me a couple days later and said, that looks like it could be a seizure. But she said, get more videos. Don't jump on seizure medications on a young dog yet. Just try to get more video.
Yeah, I agree. I mean, it might not necessarily be time to be on medications until we look a little further into the cause. There are neurologists right there in your area. I'm from Clearwater, so I'm familiar with the Port Richey, Newport Richey area. There is one in Clearwater, and there's one in Tampa.
Right. I called the one that she gave me. I won't mention names, but when I called him, he said, whoever answers his phone said that usually they would do an MRI first before seeing him, but they feel that an MRI shouldn't be warranted yet, that my local vet should be trialing an error with stuff right now. But she really wasn't willing to go that route. She really just wanted him to be right. I guess she didn't feel up to it, so she just wanted to hand him to a neurologist. But I don't know if there's another neurologist that does it differently.
Yeah, I'm not. Obviously, I'm getting way outside of. I'm interpreting what you heard from them, but usually the way the process would work, at least with us, is we would do an evaluation first as a neurologist. So yes, primary care veterinarian or emergency veterinarian would see the pet and would say, yes, this is a neurological problem, or it might be a neurological problem, or gosh, this is just weird, go see a neurologist. That's usually how patients come to us. But before we ever do an MRI, our steps would be, we would first evaluate the pet. We would look over all of the tests and blood work and records from previous. We would look at videos like you've supplied, and we'd examine the pet. And based off of our examination, and it's not just a neurological examination, it's an orthopedic evaluation, and the palpating the belly and listening to heart and lungs and looking in the ears and in the mouth. And based off of that, we're trying to whittle it down to, well, dog is doing this weird thing, to, well, it could be neurological. And now we've done a neuro exam and we've said, well, yes, this pet looks like it has a neurological problem or not. Assuming it has a neurological problem, from there, we talk with the pet parent of, well, these are the things that could be causing, well, this is where your dog's problem is. And for seizures, it usually means the front part of the brain, or somewhere else in the body systemically that's affecting the front part of the brain. Then from there, we try and say, well, what are the possible causes? And then from there, we talk with the client about what are the ways that we can start crossing off things from our list of possibilities to try and land at a diagnosis of, this is the one specific reason that your pet is having seizures, so that we can best know what the most specific, I don't like we're using the word aggressive, but the most, the best treatment is based off of that one particular dog. So I'm not, I think most neurologists do it that same way. So I wonder if something was lost in translation, where they'd say, we want an MRI before we'll look at your pet. I can't speak for everyone, but I think most neurologists I know that they would do it a similar way to us. So I don't know if it was just a lost in translation.
Okay. That's what I was wondering, because I'm new to neurology and dogs.
Oh, sure. Everyone is.
Dogs forever. I was like, that answer just didn't seem right to me. I was like, okay.
All righty. Well, yeah, I wouldn't give up, on this. I'd keep pushing. And if someone's not giving you an answer and you're kind of getting a runaround, keep asking your veterinarian, just because the video you've sent, something's going on, and it might be a seizure. And to me, that should be looked into further. Yeah, we hope for all of our pets that it just magically goes away. And sometimes it does, but sometimes it doesn't. And that's where I think it makes sense to arm yourself or prepare yourself and get as much information as you can, whether it's from the internet, whether it's from two guys on Zoom, or whether it's from your veterinarian or a neurologist in your area.
All righty. Thank you.
All right. Take care.
Bye-bye.
Thanks. Bye-bye. All right, Dr. Webb, I don't know if you've got the Google sheet up here. Oh, look at that. Now I feel like I need to have a virtual background with my
Well, it's either that or you'll see the cats and the dogs all running around. So. Hi, guys.
Hi, Jason, tell us about your Boykin.
Well, I'm going to tell you a quick background of my Boykin and how, and then go into some questions, because I have become kind of, in our small social networking community now, as everybody tends to use social networking, become the go-to person a lot of times for Boykins with IVDD. I was out of town in Georgia about 6 years ago with my two Boykins, and I had an episode with my oldest one, and we rushed him to University of Georgia. We ended up finding out he had herniated 5 discs and was diagnosed with IVDD, which 6 years ago, never heard of it, never knew about it, didn't know what was going on with it. Since then, now everybody says, talk to Teresa, she's been through this. Talk to Teresa, she's been through this, because we went through the whole gamut. We saved him. He has a wonderful quality of life. We did the surgery, we've done the rehab. He walks with a little gimp, gives him a little character. But you know, we went through 6 months of pure hell trying to get my dog back. So anyway, we are seeing now, unfortunately, 10 in the last 5 months that we know of, Boykin's herniate discs. Devastating, as you know, $5,000 to $10,000 minimum if you want to save your dog. And so there's some questions that I have because the foundation, I know Boykin Spaniel Foundation is doing a study, but the rest of us that are out here that I call our IVDD survivors are kind of banding together and wanting to ask some questions and put out information for people. The first thing is about testing. So we know that UC Davis and Paw Print Genetics is now providing a test that will let you know if you have the genetic markers, you know, the 2 chromosomes. So it will let you know if you have 1 or 2. My Kona had, after we tested him, had 2 of the mutations. But what we're being told by the geneticists is that if you have 1 or 2, it does not matter. It's a dominant gene, and it does not guarantee that your dog will have the symptoms, but it does make it predispositioned to have an issue. So I'm trying to get out information, and most of my friends, I shared this, they're watching it right now because they're all in. We have, unfortunately, we lost a dog last night because of time frames as well. You know, they go to an emergency vet. 9 times out of 10, this happens on the weekend or at night. And they go to an emergency vet, they want to give it a muscle relaxer and send it home for 3 days. And what I'm finding out is that that's not a good thing, that we've got to get time critical because of the spinal cord and how much damage there may be. And they need an assessment and a very possible MRI. And a lot of people have been not aware of what's going on. And you know, if they wait too long, unfortunately, they may develop that myalgia and end up having to put the dog down, which is what happened last night. So I guess I'm just kind of babbling, but just trying to get your thoughts first on, you know, the time frames, what you would want if we're promoting the testing now. So people are saying, my dog's got 1 gene, my dog's got 2, what do we do? What would be tips that you would recommend? First of all, if they're showing hind end issues. And if you guys could email me or, you know, in the messages later, some any kind of information you have that we can share with our people, you know, how critical it is in time with a herniation with IVDD, and then maybe tips and tricks on keeping your dog safe if they've been tested for it, you know, because now they're all paranoid. Is my dog going to have a herniation? So I'll let you guys talk. Sorry, I got a lot of questions. So.
Oh, and then that's just me typing them down to make sure that we get to all of them.
Yeah, so I guess to kind of go through some of them, you know, like you've already said, we do have this genetic test now, and it can be helpful to at least be aware that your pet specifically may be predisposed to having the herniation. But like you said, this is a genetic test. So does my dog have the ability to do this? And does my dog actually have a herniation event down the line? You know, more likely, but it's not a direct correlation. Like not all dogs will actually go through this. And so that's the difficult part. But I think knowledge is power. So if you know an owner chooses to have them genetically tested, know about it, then they should educate themselves on what should we look for, and thus the timing stuff comes through. So generally when dogs have had a disc herniation, when they're milder, we kind of will just see some back pain. As that progresses, we start to see weakness and an incoordination in the back legs. And then when they start to get more severe, we'll see an actual, you know, paraplegia or a paralysis of the back legs. Very worst case scenario is where we have a paralysis and the patient can no longer feel their toes. So if we pinch, their nail beds and their bones and their toes.
The deep pain.
Exactly, a deep pain negative patient. Yep. So that's the worst grade that we can get in. So as far as prognosis, most of the research that we have is as long as the pet is still moving their legs and even if they're paralyzed but can still feel their toes, they have a really good chance of making a full recovery still at that point. Most of the time with MRI and surgery, sometimes there's still medical management options even. So if an MRI and costs are still something that they can't pursue financially, there's still potential options. So getting checked out is always good. There is research and some people believe different things and practice different medicine, but once a patient has reached the point of being deep pain negative or no longer being able to feel the toes and are paralyzed, time can be of the essence there. I generally will take those patients to surgery as soon as physically possible to try and get the best outcome. There's some research that says within 8 hours, there's some research that says within 24. In general, the theory is you've reached the worst that you can be. If that patient can be taken care of immediately, that's the best that we can generally offer. So I think that answers some of the questions, but if you have more, I'm happy.
Well, because that's my concern as a dog owner, is trying to get the word out that, and as a community, of course, now we're promoting pet insurance because this is such a costly and devastating injury, to cover those costs, because now, lots of GoFundMes, because I certainly don't want a dog to go down because they can't get the MRI.
Yes.
The thing that we're running into as well is that some of the neurology specialists that are out there are not really being friendly in the sense of letting a dog getting in and getting evaluated. They want, the one yesterday, one of them, they wanted $6,000 up front, boom. And, I get it, but I don't get it, because if your dog is compromised, and most of the time when I hear about it, the dog it's it's not a little weakness, it's my dog won't move, they're dragging their back legs. That's usually when I hear about it on Facebook. And do you foresee the cost coming down on MRIs and evaluations so that we can make this easier for people?
Yeah, so those are all really good questions. So, to kind of get into the cost of things, unfortunately, MRIs are super expensive machines to begin with. And then a lot of things that, most people don't think about to maintain that machine is super expensive. Patients do have to go under anesthesia, veterinary patients, to get the MRI because it's very loud, and they have to sit very still to get a picture of a spinal cord that's really tiny. And so all of that does add on a lot of cost. And as neurologists, we are very aware of, the field of medicine that we've gone into is expensive and can be cost prohibitive for some owners. So we are very much aware of that. And it is unfortunately common for us to take deposits up front so that we can make sure that we can still provide those services. If it were up to us, we treat every animal for free, but unfortunately that's not something that we can maintain. So, getting into that, I think you're absolutely right in promoting insurance for pets, because it has been a game changer and provided care where pets, I think, probably wouldn't have gotten care before. There's multiple policies out there. The big thing is looking through. They are starting to categorize some dogs as predisposed, or saying, hey, we're not going to cover these things because of genetic predispositions. So I think it would be very wise for anyone that takes over a pet to think, hey, how am I going to provide for it in the future? So health insurances, there are other forms of credit lines. So outside of the insurance, we also use care credit here that can be very helpful. And we also have some workings with some local banks that will also help provide funding in those emergency situations when owners, need some time to raise the money or need to move finances around. I think for right now, unfortunately, MRIs and things are going to stay expensive because of the equipment that's needed to do the job safely. Hopefully in the future, we'll be able to, bring some costs down, but I think that insurance is something to strongly have, or have a line of credit like Care Credit to be able to handle those emergency situations, because you're never expecting the emergency to happen. Like you said, it's always nights, always weekends, but having that thought ahead of time when you get your pet is super helpful.
Okay, do you have some tips on, like, if you get tested and you have one or two of the genes, are you seeing tips like core health that might help with back strength, using ramps? Are there things that you might suggest?
Yeah, trying to limit some of those high impact activities, which is easier said than done for Boykins. I don't know that I've ever met one that was doing less than 120 miles an hour in the exam room. So you have to walk a fine line of, can we try to limit jumping in and out of like trucks if they're, working dogs, sporting dogs, try to avoid them, bounding down the stairs. Those can all be helpful. Ultimately, we can't stop the degenerative disc changes because that's genetic. So at some point they can still have that happen. But, at some point you also have to let them be dogs. These are bred to be high energy, working dogs. And if you put them in a cage and put them in a bubble for their whole lives, they're not going to be happy.
Right.
So I think it's wise to try to avoid some of the big high impact stuff as best as possible while walking the line of, we bred them to be high energy dogs. We got to let them, live their life. So it's as far as, as a breed, where do we go from here? I don't know if they put forth some research of, breeding it out as best as possible, but you have to be really careful when you start doing that. Then you start getting other genes that are bad. And those are all things that are outside, my schooling and expertise.
Oh yeah, that's, we're trying not to go down the, at least the owners are trying not to go down the breeding thing.
Yeah.
And the other thing I've been trying to tell people is, why didn't we know about this? But the testing just came out last year. So we can't fault the breeders because nobody was testing for it anyway. We're just seeing it more because of the shorter legs of the Boykin, and being in the Spaniel family. Do you guys know of any other breeds or organizations that are starting to track IVDD really well?
Not that I'm aware of outside of the genetic work that was done at UC Davis. I don't know. I know a lot of the kennels and breeding groups are paying attention to that research and have promoted the testing, but I don't know if they're doing, any long-term stuff on their own. A lot of the breeding kennels will report back. So a lot of vet schools will, reach out and say, hey, can we recruit XYZ breed to be in the study? So I know that they've done some collaborations like that, but outside of that, I'm not aware of anything right now.
So you would basically then, to wrap it back, is that if they're showing hind end weakness, which, when you see it in a Boykin, it in a Boykin, like you said, high energy, and when they stop moving, it's noticeable. Do you recommend going to a specialist right away? I know people, I tell them go to their vet, but I'm finding a lot of these vets are just not really knowledgeable enough to handle a neuro situation.
For sure.
I guess, Dr. Webb, if you can answer it sort of through two lenses. One, I guess, what you'd like veterinarians to know when you want them to refer a dog with suspected intervertebral disc
without compromising their health, right?
And two, what owners should know, just in case, because we do see it sometimes, where we wish we would have seen that dog, and and it wasn't the recommendation that was made, and that client would have come, had they known. So
So I mean, looking at it from the owner lens of things, knowledge is power, and as you're promoting the information of, hey, what to look for, this hind end weakness, dragging of the legs, understanding that that's a neurological problem as an owner is super helpful. I am a proponent of, just go to a veterinarian. Like, there's no need to just get in a car and drive hours away. But if you can get to a vet and be evaluated, most veterinarians are comfortable enough at least acknowledging that, hey, this is neurologic. And they're really good at screening for a lot of the bony things that we deal with. Is there a broken bone? Is there a ligament rupture in the knee? Would be another thing that can look really similar. So they do a pretty good job of triaging, that. But if at any time as an owner, you're still concerned about something that's going on, especially if it's not responding the way you want or progressing, it's never wrong to pick up the phone and call and say, hey, this is what I'm seeing with my dog. Can I get, in for an appointment? And, you could go to the specialist then, from the veterinarian lens of things. Like I said, they deal with a lot and they see a lot of things. Some of them may not be as comfortable with neuro stuff. From a veterinarian standpoint, I think, here at least, we're very open. If you want to pick up the phone and call us and reach out and say, hey, this is what I'm seeing. Do you think that this could be neurologic? Generally, we're very happy to work with the vet on the phone and say, that definitely sounds like it. We should schedule an appointment or get them in sooner rather than later. And I know that we work pretty well with our veterinarians in our area if they're unsure. We will work with them on the phone. We can't always work directly with owners in that situation because we haven't met the pet. But, those would be things to look at in both lenses. If there's ever an uncertainty, certainly calling and asking and having an appointment is valid.
Well, I can't thank you guys enough. And especially because, we're starting to share your webinars and stuff on our social media sites. And if there's, I don't know if you can message me, a place where we can get some paper documents, maybe of, a neuro checklist. What do you see as the signs and when you should seek some help, would be great for us to get out there. We're just trying to really get people involved in what the disease is. And being that, we lost one to the say that again 5 times, myelation.
Yeah.
Which, when I'm talking to people, I'm saying, let's get them in and get an MRI because you've got to test that health of that spinal cord. That's, because I know that's what they told me. They leave the emergency vet, my vet, God bless her, I called her long distance and she said, put your big girl pants on, go drive to the university. And I'm so glad I did because they said if I had waited much longer, he would never have walked.
So we do have some handouts and some information. Obviously on our website, there's a bunch there, but we've got some already printed and or printable handouts. They might have a lot of pictures of dachshunds and French bulldogs on it. So, but a lot of the information still pertains when we're talking about intervertebral disc disease. So with regards to, at least when I want a veterinarian to send a patient sooner than later, kind of for me, the line in the sand of when I want to see them now is if the dog stopped walking. So if it's first time that we're just painful or we're owie or we're still walking but we're wobbly, that's the time where I do think it's okay, as you wrote here, of giving some rest and some medications for a few days and, sending home from the emergency clinic and seeing, hey, how does it look in a couple of days, as long as it's not getting worse. For me, though, whether it's an emergency veterinarian or a primary care veterinarian, if that dog stopped walking, so if it's unable to walk, but it's dragging its back legs and shuffling behind, or if it's not moving them at all, or obviously if we're unable to feel the limbs, those are dogs that we would prefer that veterinarians are sending to us right away, just because once we've kind of crossed that line from walking to not walking, one, I just want to assess it in person to know whether we're that dog that's not able to walk but still moving, or whether we're that dog that can't move the limbs or can't feel them, because that changes the prognosis, it changes the likelihood of getting better. But 2, I just don't know where in that downward slope is that dog. Is it going to stop at that unable to walk but still moving and then get better, or is it going to keep getting worse and lose the ability to move and the ability to feel the limbs? So for me, if you're a pet owner or if you're a veterinarian, if it's a dog that's gone from not walking to, has gone from walking to not walking, that's something that we want to see right away. And like you said, most of the time it's at night or it's on weekends, and that's why we're available evenings and weekends, just because we get it that time is of the essence in those pets.
Right, and that's what scares me. So that's I usually ask when they call me. I said first thing I do is I said I'm not a doctor, but pinch between their toes.
But you don't necessarily need you don't necessarily need to do that, because a lot of people do that, and we'll get a dog that, so pinching between the toes, I mean, it takes some practice to get used to it and know how to interpret it. Because when you pinch the toes, some dogs will pull the limb back, and that's a reflex and doesn't necessarily mean that they can feel it. So we'll often have dogs where where someone says, oh, they can feel it because they pulled their leg back, and when we get that dog, they cannot feel it. They don't actually sense it. And we get the opposite, where we hear that dog can't feel it because the person's not pinching very hard. They're just not used to pinching dogs' toes, and that dog comes in and it's able to walk. So I wouldn't necessarily go straight to, pinch the toes. I guess I'd first ask, are we able to stand up and walk? And if it's no, that dog should be seen by a veterinarian to pinch toes to do a complete neuro examination.
Perfect. Well, thank you guys so much. And we will keep sharing your information out. And, it's unfortunate that we see this in our dogs, and especially now starting to see it in our breed, because our breed is fantastic. They're hunting and companionable, and activity is what they are. They don't like to be couch potatoes too often. So, but are you guys seeing more Boykins down there?
I couldn't say.
I'm going to ask the hot question.
I actually saw several in the past week, which I had not seen many here, but I did see a lot when I was in my residency in Wisconsin. We actually saw several there. There were some breeders in the area, and they used them for hunting there, so I was used to them there.
Okay, well, thank you so much, guys. I really appreciate it. And if I think of anything else, I'll be sure to email you.
We'll be here.
Thank you.
Dr. Webb, my husky just started on Phenobarbital, and all side effects have subsided except the potty accidents. Could that indicate she's on too high of dosage? So husky recently on Phenobarbital, experienced side effects. Most of them have gone away except for the peeing a lot. And I guess, how would you determine, is the dose adequate or too high or whatnot?
Yeah, so it certainly can be a side effect of phenobarbital. So some of the big side effects we see with phenobarb would be increased hunger, increased thirst, and increased urination. And sometimes I do have patients that will kind of have accidents because their increased thirst, increased urination habits can offset their kind of potty scheduling. You could also see some drunkenness and some sedation when we first start pheno. So one thing that would be nice to do is you can always check the level of phenobarbital in your dog's bloodstream. So generally, once we start that medication, you'll recheck it in about 2 to 3 weeks to make sure you've hit a level that is safe and hopefully within the therapeutic range to stop the seizures. And then, as we've talked about before, you have to draw the line of side effects and seizure control. So whether or not we increase or decrease that would be based essentially on the level and how your pet's seizures are.
Great. Well, I appreciate you getting on today. This is Dr. Webb's 1-year anniversary working at Southeast Veterinary Neurology. So I appreciate you being here, and I'm happy that you've joined the team, and I hope that it's everything you hoped for and more.
It is. I appreciate being here. Thanks for having me.
All right. Take care, everyone. Bye-bye.